If you're a baseball fan, you've probably heard of a rotator cuff by now, but if you haven't, it's the group of tendons and muscles that hold your shoulder in place, that connect it to the shoulder blade back there. And injuries to the rotator cuff are common. In fact, on average, there are 4 million rotator cuff injuries each year just in the U.S. So it's good news that there's a new technology out there to help repair them that is healing people faster than before. Dr. Chris Betz, he's a sports medicine surgeon at Bristol Hospital. And doctor, you are the first in the state to perform this procedure. It's called the Rotator Cuff Biomedical Implant. That's a long name.
It's a long name.
By the way, happy to have you here, doctor.
Thanks for having me on.
Okay, we have a little, look at this. We actually have a diagram here. This is of the arm bone, the humerus, and this is the implant right there. If we can sort of get let's turn it right there. So what are we looking at right here, first and foremost?
So basically, this biomedical patch is used for patients' rotator cuff tears.
Okay.
Now, it generally regenerates the tissue in the tendon itself, so it's the patient's normal tissue after it finishes the process.
Okay.
It's fully reabsorbable.
All right.
The nice thing about this thing is, so the traditional rotator cuff repair involves taking an edge of the tendon, repairing it down to the bone with the anchor and sutures.
Okay.
With this patch, we're able to add tissue bulk to that tendon, taking the resistive forces off of it, allowing it to heal better.
Okay. When you say tissue bulk, what do you mean by that?
Tendon thickness.
Okay.
Generally these rotator cuff tears, when we repair them, there's a lot of stress on the tissue itself. This helps to increase the size of that tissue and take some of the stress off the tendon itself.
Okay.
One good thing about this too is that, partial tears, we have a tendon tear that's some degenerative tissue, not completely torn. We have 2 instances we treat this. One is that you debride the tendon, hope it doesn't tear more later on.
Okay.
Second issue is that maybe it's torn so much that you just want to debride the tendon altogether and treat it like a normal rotator cuff tear, repairing the tissues and the anchors and the sutures.
Okay.
With this patch, you can just patch right over it, avoid that whole process.
All right. Now, I saw in this animation that was playing while you were talking that it looks like this is done minimally invasive.
Correct.
Only two small cuts. Is that how a regular rotator cuff tear would have been treated before?
Generally, rotator cuff tears, there's a couple poke holes, whether it be 4 or 5.
Is that a medical term, poke holes?
Poke holes. I like to call them, it's a small hole.
Yeah, okay.
But generally, 2 to 3 holes is how you do it, not usually more than that.
All right. Talk to me a little bit more about the mechanism, about why this works the way it does. It almost looked like something you'd put in for people who have a hernia just to try to keep everything in place, but there's not really anything you're trying to stop from escaping right here. So why is it that just putting a little implant on there helps in the way that it does?
So with rotator cuff tendons, the major issue is that you have to balance the forces. There's a lot of stress going through the tendon insertion site. Also, there's the issue of where the rotator cuff tears, there's an area of blood supply that's lacking. We call it a watershed area. It just means there's blood coming from the outside tendon, maybe one quarter of the other side, but it doesn't really heal that well because of lack of blood. So what this tendon tissue does is you basically patch over the area, you decrease that stress, so the biological forces are more aligned, and then you also, we believe, adding angiogenesis or blood vessel growth into the area.
Okay. And so this is, it's sort of trying to grab everything together. Well, let's go back to this. I want to take a look. Okay, so this is the rotator cuff right here, this part. And this is the arm bone. This is the collarbone, in case you can't tell, right? So is this pulling what do you want to say, the injured area together, tighter? And is it reducing the stress that way?
I think it's just by it reduces the stress by actually adding bulk to the tendon or more tissue to the area.
Just more, okay. All right. So structurally, that's how it's going to work. So what is it doing for recovery times?
So recovery time, normal rotator cuff repairs, the patient is in a sling for about 4 weeks. With this new tissue technology, they're out of the sling in 1 to 2 weeks.
That's amazing.
And generally, rotator cuffs go back to full duty 6 or 7 months later. With this, we're getting patients back at about 3 months, maybe a little more.
Okay. And for people who have to use that for a living, for sports, because you're sports medicine, for somebody who's a pitcher, is that the same timetable, sort of an accelerated timetable for them too?
It definitely would be, depending on injury itself, obviously. But, it's also important for your manual laborers. A lot of these people want to wait around for 6 months, not working. A lot of them are like private business owners. They have no choice. So for these people, it's actually very important to get back in 3 or 4 months.
Lastly, personally, how cool is it that you're the first one in the state doing this?
It's pretty cool.
Yeah?
Yeah.
How long did it take you to learn?
It took about 2 times.
2 times?
Yeah.
I'm not doubting you're right. It's just, it's weird to think that something so big, so innovative, 2 times, I'm good, I got it. It's a lot of the same
practice.
stuff. Yeah, and this is the wonder of technology. And if you're interested, remember, Dr. Chris Betz is at Bristol Hospital, a sports medicine surgeon. Thank you so much for taking the time to educate us, really. I appreciate it.